In this video, you will learn about abridged regulatory pathways with reference to PMDA assessments based on reliance. The World Health Organization, or WHO, has published a document that defines the key concepts of reliance. As reliance among regulators grows, the level of reliance will increase step by step. The purpose of reliance, according to WHO, is to promote a more efficient approach to regulation, thereby improving access to quality-assured, effective, and safe medical products. WHO also describes the merits of reliance as being 1. National regulatory authorities, or NRAs, gaining greater efficiency in regulatory operations, and 2. NRAs avoiding duplication by using a reliance-based approach. There are many ways to effectively utilize reliance-based approaches. In this video, abridged pathways using reliance will be introduced. This is WHO's definition of abridged regulatory pathways. Regulatory procedures facilitated by reliance, whereby a regulatory decision is solely or partially based on application of reliance. This usually involves some work by the NRA that is practicing reliance. It is expected that use of reliance in these pathways will save resources and time as compared with standard pathways, while ensuring that the standards of regulatory oversight are maintained. For example, the result of an assessment by a reference regulatory authority in Country A can be utilized through the pathways by Country B or C. By referring to the PMDA as a reference regulatory authority, NRAs can receive these benefits. They can directly communicate with the PMDA about PMDA review reports. They can refer to Japanese data, which may include some similarities as regards ethnic factors. They can access post-marketing safety information published on the PMDA website. To support reliance pathways, the PMDA and industry representatives in Japan have established a scheme for that purpose through discussions. An applicant prepares an English translation of a PMDA review report, attaches a cover letter, and submits an application dossier to a regulatory authority. During a review, regulators can directly ask PMDA regarding the content of the review report. The PMDA will answer their questions. This scheme can reduce inquiries made to the applicant and may shorten the assessment timeline. The PMDA shares a finalized PMDA review report containing no redactions with the Japanese Marketing Authorization Holder, or MAH, but the report is only in Japanese. The applicant needs to prepare an English translation of the PMDA review report. There are 2 ways to prepare an English translation. If a review report is only in Japanese, the applicant translates the entire report into English. If an English version is available on the PMDA website, the applicant will prepare a complete report by adding an English translation only to parts where the information is partially redacted. Some regulatory authorities may request a guarantee of authenticity from the applicant. To respond to the request, the applicant can ask a third party, such as a translation company, to issue a certification of translation. The PMDA provides lists of approved drugs, medical devices, regenerative medical products, and companion diagnostics on the PMDA website. The lists include all products approved from 2004 to the present. Some PMDA review reports are translated into English and made available on the PMDA website for the purpose of sharing the PMDA's thinking and decisions in reviews with overseas stakeholders. These review reports can be downloaded for free. Examples of countries and regions that recognize Japan as a reference country have also been posted on the PMDA website. Please check the website for the latest information.